But we begin with the federal government's roadmap to a return to normal. Here's the target Canada needs to reach: at least 75% of adults with 1 dose of a COVID vaccine and at least 20% with 2 doses. Health officials say that is when we can start lifting some of our tougher restrictions. It's expected we'll reach that target this summer. Now, according to the guidelines, you could be able to gather outside with family and friends, or go camping or hiking, have picnics, or be on patios. The feds hope to reach a new target by fall. That's 75% of those eligible fully vaccinated. At that point, we can gather indoors with people from other households. We can go back to indoor work, we can play indoor sports, and college and university students could go back to in-person learning. For more on all of this, I'm joined by Dr. Howard Njoo. He is Canada's Deputy Chief Public Health Officer, and he joins me from Ottawa. Dr. Njoo, thanks for joining us.
My pleasure.
So you've given us a bit of a roadmap here with this 75 and 20 metric, 75 first shot, 20 second shot. Do you need to see those numbers right across Canada before we can move to this recommended reopening, or could local jurisdictions do that if they make quicker progress on their vaccine rollout?
Oh, definitely. This is more sort of an aspirational goal for all, I would say, local communities to aim for. Certainly, it's not something we're looking at a national level, because as we all know, it's really more important what happens at a local level. So, as the vaccine coverage goes up, at the same time, it's also important to see what happens in terms of community transmission, making sure that, the case counts have been pushed down to manageable levels, that the local sort of healthcare system is not overloaded, and there's plenty of capacity. So definitely, yes, it's all about what's happening at local level, both the epidemiology and, of course, the vaccine coverage rate.
Right, and so this is guidance that's coming from the Public Health Agency of Canada, but ultimately it's provinces and cities that are going to make this call. So we've even seen, like, Saskatchewan, for example, has its own reopening plan based on vaccination rates. So how do you see this guidance interacting with provincial plans and more bespoke, localized programs?
I think they're very complementary. Certainly at the national level, we put this, I would say, by consensus with obviously the provinces, territories, sort of an aspirational goal. But obviously, it's important to have it operationalized at a local level. The one point I would make, be it the Saskatchewan plan or any other plan, is that we all recognize that it's not just a matter of, quote, hitting so-called vaccination coverage targets, but it's also important to look at the indicators to see what the level of community transmission of the virus is, and also to see what the impacts on the healthcare system are. Because if, for example, in many parts of the country, it's still a third wave with lots of cases and the healthcare system being strained to the limit. With that, not under control, then certainly I don't think we can just sort of point to vaccine coverage rates alone as being sort of the gateway to opening up.
So when you look at the indicators, how optimistic are you that we may be getting near the end of this particular chapter of the pandemic in Canada, getting near the end of the third wave?
Well, as we mentioned today, certainly at the national level, looking at the epidemiological indicators, it's trending well. It looks like we're on sort of the sort of going down from the peak, and the case numbers are trending in the right direction. But as we all know, it just takes a sort of letting your foot off the gas, so to speak, that it could then go in the opposite direction. I think many jurisdictions have experienced this, and I think hopefully we're all learning from that and doing better and making sure that we don't let our foot off the gas. I think, obviously, I'm a resident here in the province of Ontario. Mm-hmm. I think the fact that they've extended the so-called lockdown or the more restrictive measures for another few weeks, I think speaks to the fact that they've seen what happens if you maybe let go, and it's important to make sure that we really have the cases down to a very, very low and manageable level before you start loosening the public health restrictions.
As vaccines roll out, you understand why people want to talk about reopening and getting back to doing things that they miss. But you do make the point that it's important to not ease up on the public health restrictions. Is there a risk in having the conversation about the return to normal and maybe not having to abide by the public health restrictions when we're still kind of at this critical point, for example, here in the lockdown in Ontario?
Well, I would think it's always good to talk about sort of brighter days ahead. So I think, in terms of looking at what we might be able to do in the future, I think that's good. But as long as people understand that for the time being, we need to continue to practice the good personal public health measures, practices such as use of the face mask, the physical distancing, and the good hand washing. and at the same time get as many Canadians vaccinated as quickly as possible. I think the important part of that is that it really is, I think a very important tool, and hopefully it lets us see the light at the end of the tunnel, because as people get vaccinated, they're not just protecting themselves and their loved ones and their friends and so on, but and colleagues, but also they contribute to, I would say, community protection, herd immunity, so that hopefully the transmission of the virus within their whole region, it gets decreased over time as well.
When you look at the metrics that the Public Health Agency has given us, is 75% first dose vaccination. You can see a path to that. I mean, we're at about 50% of the eligible population there. There's 4.5 million doses coming next week, so a massive jump on that. But we're only at 3% of second doses. And when you look at where your roadmap leads to 75% fully vaccinated by the fall, how confident are you that we can run that path to get from 3% second doses to 75% second doses before September? Because that seems like a big lift.
I think I'm very optimistic. Certainly, we talk very closely. We communicate closely with the provinces and territories, and certainly they've upped their capacity to, as they say, deliver and vaccinate Canadians in a very, I would say, a quick and efficient manner. And I've certainly experienced that myself, having gone through a vaccine clinic here in Ottawa. So I think as people have received their first dose, I think they're starting to look at it with more vaccines coming into the country and into each of the provinces and territories, getting ready to vaccinate people with the second dose. Obviously, starting with the same kind of thinking, the priority groups first, the ones at greatest risk, and then moving down to others as well. And I think that we're well on track, certainly with the number of doses of vaccine coming into the country. I think that it bodes well for people getting their second dose. I think maybe sooner than maybe sort of the full sort of 16-week interval that maybe people started off with. The other part, though, I think is important to underline is that, I think the concern that many people had initially with, the extension of this dose interval, I think as you see from the studies or the trial that was done in the United Kingdom, I think it's very encouraging. They actually vaccinate people, let's say with the Pfizer vaccine, and looked at the antibody levels after sort of the standard 3 weeks based on, the product monograph, and after 12 weeks. And they found that actually people who were vaccinated with a longer dose interval actually had a better antibody response. And I think that's not surprising to many who actually, understand and are sort of versed in the vaccinology and immunology in terms of the principles and what we know from our experience with other vaccines. So I think at the end of the day, I think it looks very good for Canadians, recognizing that they have a good level of protection with one dose. And even if, let's say, they have to wait several weeks for their second dose, in the end, it's probably even better for them as well.
So one last question before I let you go. At the end of the roadmap, you talk about the fall as 75% vaccination rates amongst the eligible population. People could go back to college, in-class learning, indoor sports, family gatherings, indoor gatherings. But what about big events like, a hockey game or a concert? When do you see life getting back to the point where that becomes a possibility again?
Well, like I say, it depends, I think, on what each region experiences in terms of community transmission. I think what we need to do is make sure that we get case counts down to a manageable level so that the public health can do their standard sort of what we used to do at the beginning, which, to be honest, I think has been sort of let go because of being overwhelmed. But the what we call the test, trace, and isolate, and quarantine of contacts as well. That's standard public health practice in terms of jumping on cases quickly, doing the contact tracing and making sure that the cases are isolated and, contacts are quarantined. If we get to that point, then definitely I can see that it may be, I think with caution, slowly having maybe larger and larger gatherings, but certainly not all at once. And certainly, I think we need to, do it in a very thoughtful and maybe a prudent manner to see, what happens if you have a few events. And if, let's say, case counts goes up and we have more problems with community transmission, then maybe we have to tamp it back down. But I think if everyone gets vaccinated, then again, it gets back to the important concept of, hopefully the herd immunity kicking in. Then I think we'll be able to manage in the fall with maybe larger and larger events, as you put it.
Okay. Dr. Howard Njoo, thank you for your time. That's Dr. Howard Njoo, Canada's Deputy Chief Public Health Officer. Thank you, sir.
You're very welcome.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.